Hi, I'm Dr. Curt Ringhofer, Complete Dentistry of Orland Park. Let me tell you a little bit more about temporal mandibular joint disorders. There's really three parts to the system. You have the teeth, the muscles, and the jaw joint. And they all need to work in harmony in order for things to last and to function properly. When one of those three parts are out of whack, I'll say, it could cause a problem. Usually, almost always what happens is the muscles win. You're either going to get wear on the teeth or you're going to have jaw joint problems. When you have jaw joint problems, it could be a muscular problem or it could be an internal problem. Think of the jaw joint a lot like your neck. There's a disc in between the two parts of the system. And just like neck pain, there's times where you could be in pain or there's other times where it's not in pain and it could come and go. What I'm there to do is look for signs that there is breakdown in your jaw joint and help you stabilize your jaw joint in order for it to be pain-free and not cause you a problem in the future. Let me tell you a little story about Terry, a patient of ours.
He fixed my jaw along with Dr. Booth, the orthodontist. The two of them got together and they figured out my jaw was constantly in pain and it would lock. And the two of them, with Dr. Ringhofer first suggesting it, getting braces and double teaming, and they totally fixed it.
She came in and she was having all type of problems, especially when eating bagels. She couldn't chew food too long, she couldn't chew gum, and it was very uncomfortable for her to eat. What her problem was her teeth in the front were too far in, which caused her jaw to be pushed back. This was causing all kind of muscular problems.
You know, I was eating dinner one night and I couldn't literally close my mouth, and then he came back again and he tried other things first, but then he figured out exactly what to do and it worked. It was perfect, it worked.
By putting her through orthodontics and freeing up that space and then getting her bite to be hitting evenly. Think of it as a snowshoe when you're walking over the snow. If you're walking just in your normal shoes in deep snow, you're going to sink right in there. But then you have the snowshoe, which distributes the forces evenly over the snow so you stay on top of it. That's what we want to do with your bite. We want to get all the teeth hitting together so the forces are taken away. The other things that happens is when you move your jaw from front, right to left, we want the back teeth to come apart. What this does is it turns 2/3 of the muscles that close your jaw off, which allows the muscles to relax. The other thing that we want to talk about is how we diagnose that. It's important when you come in, the four things we're going to need to do is we're going to need to do a thorough examination. We're going to need to take some photographs, some models, which show us on an articulator, which is a tool that mimics the way your jaw opens and closes. What that's going to do is allow me to see how your teeth fit together. It allows me to become very small and kind of climb inside your mouth so I can see from the tongue side how your teeth fit. The other thing we're going to need is imaging. Typically, TMJ patients are going to need a CT scan and an MRI to get the proper diagnosis. Now what I like to do is send you to my website so we can give you a little bit more information, or very easily you can call our office. Please give us a call anytime at 708-349-0022. Thank you for your time.